All right, so when we're doing passive range holds from prone position, we're assessing their passive range of motion versus their active strength. We can really do this in any position, but to standardize it, I'll usually start in a T. There's two ways we could do this. A, we could just break it down and isolate glenohumeral joint, pin the scap, see how much your glenohumeral joint can come up into a T position before they reach their end range, and then hold from here. When I have him hold, I'll slowly ramp off once I feel that he's able to stabilize in this position. If he can't and I just drop down, he's gonna drop down with me, so we wanna make sure the process is slow. Good, reset. If we wanted to couple the glenohumeral and scapulothoracic joint, maybe even get a little thoracic rotation, depending on if you view it as a compensation or a benefit, depends on the sport, depends on the individual. But we could take them once we feel they're at their barrier. So this coupled position will be a much higher range than the just glenohumeral. Hold right here. Okay, so his active and passive strength is pretty good. Yeah, it can look like a compensatory pattern. For the sake of this, I don't necessarily care. And in fact, sometimes I'll encourage to grasp using your other hand or anything you need to stabilize, because we're applying a lot of radiation. We can create more tension, more force, the more parts of our body we're using. Okay, so once someone can do a T, this is probably good enough today for his working sets based on the difficulty this possesses, but it's fine. Other positions we can go on would be an extended position. End range extension is, for whatever reason, very rarely trained, but just as important. So to standardize it, we're gonna make sure we're taking him up in a line. He does a really good job of keeping his elbow straight and his wrist pretty straight. A lot of compensations you'll see relax. As soon as we take someone up into extension, they'll flare out here. They're much stronger in a slightly abducted position than they are keeping their hand close to their hip. Relax. So that'll show us another good rep. I passively take them up. A lot of patients will want to help guide us up, and then that's just their active range of motion. We get much farther passive, so we'll passively take them. Make sure they're relaxed, hold, elbow locked. Nice, really good here. So we have T, extension. We could do Y as well. Glenohumeral plus that scapulothoracic, hold. Same cues, elbow locked, scap down, boom. Good. And then fourth position we can test, just for the sake of the video, ER. So his arm, his humerus is pinned against my leg. I'll take him into a max ER passively. I'll let him posterior tip or tilt the scalp, that's fine. And then once he's out of position, whatever pronation, supination he wants is okay. Hold here. First, back off one arm, make sure he's stabilized. Back off other hand, make sure he's still stabilized. Back off the leg. We got a shaker on aisle 3, but that's okay. We'll do another rep.
This was tough.
This would be a progression from the T. Hold. He's stable, back off one hand, make sure you can keep his range of motion. Back off the other hand, range of motion still intact. Take off the leg, boom. Good. You can adjust the reps, sets, go back and forth, superset this with another drill, or just different positions prone. There's not necessarily a right or wrong. Just make sure when you're dosing it, you're making sure you're assessing their active and passive range.
Question.
Don't just arbitrarily give them 10. Yeah.
If like let's say someone's like in closer to end stage stuff,
Yeah.
will you ever have them do drills like this in between like their lifts as kind of like just like maintenance
Yeah.
work?
So they might have like their A1 as a bench, A2 passive range hold, B1 row, B2 another passive range hold. Yeah, that's fine.
And then how much harder is it to get to end range if you don't have like a partner or someone like supporting you to get you there? Should you try using like a block or something?
You can do a block for a lift off, but I'll show you some other ways to get passive range holds without a partner.
Okay.
Yeah. So these are partner passive range holds. And then any other questions? You can do any position you want. The 4 that are standardized T as your base. If that's okay, you can progress to extension Y, ER.